We all want a break after our seasons of COVID, but the coronavirus is not done with us yet. And now add in a strong onset of RSV, a respiratory syncytial virus, and what is developing into a severe flu season.
In Clark County, we're seeing a significant increase in respiratory illness, and it's gotten to the point where it's really having an impact on our local urgent care facilities and hospitals.
The impact at Peace Health Southwest Washington Medical Center is real. A hospital that normally would average 280 to 310 patients is virtually full with up to 380. And an emergency department with 42 beds is holding 120 to 130 patients.
We are seeing people wherever we can. We're opening up new units. We're getting a lot of support from our hospital in terms of being able to see patients in other areas. But at a certain point, there's just a lot of people needing care at once.
Dr. Jason Hanley commends his staff for stepping up to meet the need, but there are ways we can help. Clark County Public Health wants people to be aware and take precautions to avoid getting sick if possible. That starts with vaccinations.
I don't think there's anything abnormal about going in and getting a vaccine. It's pretty quick, it's pretty easy, and it's incredibly safe.
If you or your child do get a respiratory illness, if symptoms are mild, they say treat them at home. If there is no improvement or worsening of symptoms, call your primary care provider first, or go to an urgent care clinic if needed.
Certainly, if you or your child are struggling to breathe, a severe shortness of breath, then you do need to get emergency care.
Now to RSV, that is especially hard on young children. That, along with other illnesses, has both Norm Becker at OHSU and Legacy's Randall Children's Hospital beyond stressed.
Our two pediatric hospitals are in crisis care, which gives them the freedom to be creative with staffing and space in order not to turn away patients or have to limit interventions for patients. But it's a sign of real distress in our hospitals and health systems across the board that I am genuinely concerned is going to get worse before it gets better.
Now, we mentioned vaccinations. Of course, there is not one yet for RSV, and that virus survives on surfaces quite well. So it's important to wipe things down and wash your hands very well. And Dr. Vine says as much as people may not want to hear it, she recommends wearing masks inside in public places till this situation passes. Tim Gordon, KGW News.